Welcome, everyone. My name is Karen Gravel. I'm a project manager, education and patient services for Myeloma Canada. I'm sorry. And I welcome Germaine Nadon. Welcome. Hi, Germaine. She is a patient and a support group leader in Calgary region for SAMPS. And we have also Anna Giulione. Welcome, Anna. She is a clinical research nurse, also in Calgary. So tonight's webinar, again, 6 p.m. Calgary time, but also 8 p.m. in Montreal. If you live towards more the east part of Canada, it's late, I know. Feel free to drop at any time if you need rest. This webinar will be recorded. So I'm going to show you in a few seconds how to get the recording. Okay. Just going to share my screen. Okay. You all can see my screen, Germaine?
Yes.
Yeah.
Yep.
All right. So just a quick introduction for today's webinar, Living Solo with Myeloma. Of course, we do have a lot of information about myeloma, about patients, about caregivers. So we were just wondering, so what if I don't have a caregiver? So that's what Germaine will talk to you about today, living solo with myeloma, and give you a lot of tricks, I guess. And here, I'm just going to give you just a bit of instructions for tonight's webinar. So just a few words about our sponsors. So without them, we couldn't do those types of webinars. So thank you to those sponsors. Tonight you see on screen us three only. You cannot see yourselves. You cannot activate your sound either. So the way we will interact together, if you do have some questions during this webinar, I'm just going to give you a few seconds to locate on your cell phone, your computer, or your iPad maybe. Just locate the menu bar on your app, and you should see a Q&A icon. If you do not, just press the 3 little dots to see more options. So we will use the Q&A for you to send us your questions, and I will make sure to give those questions to Germaine or Anna if it's more towards the medical part. And we will use also today polls so that we have your input today. So it's like question answers. You just have to enter what you feel or your comments. And then reactions, if you do have this option on your tool, feel free to send just a little thumb or some claps to encourage Germaine during our session. So these are the tools you can use. And of course, this webinar will be recorded. So at any time, if you need to leave, you can surely see that webinar again at a later time. So you go on the Myeloma Canada website, myeloma.ca, and then you go in the resources tab, and you will see educational videos. This will bring you to the YouTube page of Myeloma Canada, and you will be able to go either in videos or playlists, and you will see a bunch of information of things we have already recorded, info videos, patient testimonials, and so on and so forth, both in French and English, a lot of material there. And if you use the subscribe button, this will allow you to actually get notified whenever we post something new. So that's all for me. Pretty quick. I'm going to jump to Germaine and let you present for today's webinar. Welcome, Germaine.
Thank you. Let me just get in here. So welcome everyone. My name is Germaine Nadon and I live alone and I have myeloma. So this has been my 9th year as of July 17th. I'll be celebrating my 9th anniversary of living alone with myeloma. So that doesn't mean that I don't have support, but it does mean that for 24/7, I live in my own home, run my own business and manage by myself. I'm a part-time caregiver and a part-time patient. As you all know, those of us that live alone, when we're on our patient side, we have to look after that piece. And when we're well, we're on our caregiver side. So we always have unique challenges, and it's always nice to talk to other people and find out what they have done and how they're managing. So today I'm going to talk about some of the things that I have found to be impactful in my life. So dealing with the life-altering diagnosis, the emotional impact, how I built my support network, what the financial impact was for me, how I managed my medications, managed my appointments and transportation, my stem cell collection and transplant, safety measures I put in place so I can remain living at home, some motivational coping skills I put in place for those hard days, some brain fog activities. And I also wanted to welcome Anna, who's kindly agreed to share and participate in this presentation with me. So as I said earlier, I'm now almost 72 years old. I'm single and live independently. I'm the second oldest of 9 siblings, and none of my other siblings have a blood cancer. We have other cancers, but no blood cancer. When I started my journey, as you can see in this upper picture, I have 2 daughters. And I have 2 fabulous son-in-laws. I now have 3 granddaughters, 1 grandson, and 1 grandpuppy. And so those have become my main support system. They don't live with me. They don't all live in Calgary either. So they're sometimes here and sometimes not here. I was diagnosed at 62 years of age. I was experiencing extreme fatigue. So that was in 2013. I could sleep 10 to 12 hours a day, get up and just get dressed and want to just crawl right back into bed. And this went on for approximately a year. And I would go out to my car at my lunch breaks, at my coffee breaks, and I'd have a 10 or 20-minute power nap, however much time I had allowed. I'd go home from work at the end of the day and I could just eat and crawl back into bed. So in 2014, after a year of dealing with the extreme fatigue and anemia, my calcium levels topped out, and the doctors were concerned. For a while there, they thought I had hypothyroidism, and then they came to the decision that it wasn't. They were 90% sure that this is my family doctor and the endocrinologist, that I had 90% sure that I had multiple myeloma with anemia and calcium affected. So I said to the doctor, like, seriously, are you looking at my blood work? Because I'm thinking, myeloma, what is that? And are you looking at my blood work? And he said, yes, I am. And so things moved very quickly after that. I was sent for a bone marrow biopsy, which some of you may be familiar with. And then 2 weeks later, I was referred to the cancer clinic and had a diagnosis of multiple myeloma, IG lambda free light chains, stage 1. And Anna's going to explain that piece to you for me.
Okay. So hi, everyone. My name is Anna, and I'm one of the multiple myeloma clinical trial nurses at Tom Baker Cancer Center. So just as Germaine was mentioned about the anemia and calcium, so for the diagnosis of myeloma, we have something called the CRAB criteria. And here, Germaine fit the anemia and calcium, which are affected. There are other criteria which affects the kidney function, and an X-ray would show lesions or plasmacytoma, and that's part of the criteria for multiple myeloma diagnosis. The common staging that we use for multiple myeloma is called International Staging System. And in 2005, a group of doctors developed this staging at the International Myeloma Working Group. And it consists basically of two blood tests, the beta-2 microglobulin and the albumin. The beta-2 microglobulin is a protein that indicates the extent of the disease, and the albumin is an indicator of your overall health. So this is a quick way to diagnose which stage. So they have it depending on, so for example, stage 1, your serum beta-2 microglobulin would be less than 3.5 milligrams per liter, and the albumin would be greater than 3.5 grams per deciliter. Stage 2 is, stage 2 is a moderate number, so it is between, actually, that's stage 3. Stage 2 is, well, actually, they go to stage 3, and then stage 2 is between 1 and 3. So stage 3 is a serum beta-2 microglobulin that is greater than 5.5, and that's considered high risk. So stage 1 here is it's still risky, but it's not high risk. So which means it's not as extensive in all of the bones, and we probably have more treatments for the stage 1 as opposed to stage 3 at that time in 2014 when she was first diagnosed. The lambda part is the free light chains. So with myeloma, you have two free light chains. You have the kappa and the lambda. So when you do your bone marrow under the slide, you can see the cells that you have, and this is where the lambda was diagnosed from. It's also in your blood. So when we do blood tests, we see which protein shows up more, and here she has the immunoglobulin lambda chain.
It's the Y shape.
Exactly, it's the Y shape,
right?
yes. Which most of you already know.
At this point, I guess.
Yes. Okay.
The one thing I
Thank
found
you.
was important to know what kind of myeloma I had, and how I can track it. So now that in Alberta anyway, we can see all our lab work. And if you can't go online and see it. Usually your doctor gives you a physical copy every month when you're in to see them. So it's good to just get really familiar with it. And your in Alberta, the monoclonal proteins determine at what level your myeloma is at. So it's good to just get really familiar with your CBCs, your creatinine, right?
Yes.
Is LDH the other one, Anna?
Yes, LDH is very important too.
Yeah.
That's also part of the substaging that we have for myeloma.
Okay. All right. Thank you. So the emotional impact, I have to honestly say that it took me 5 days to phone my children and tell them that I even had this. And then it took me another 3 weeks where I had my head buried in the sand. I couldn't even look at an article. I just couldn't go there and do any of this. So it is quite common to be in denial or whatever, just be overwhelmed with the whole thing. I was really sad. Here I was only 63 years old. I was I was close to retirement. I wanted to travel. I wanted to do some things and I couldn't. And then the first weeks were just a blur. And there was so much going on with appointments and this test and that test and accepting the diagnosis, balancing my work and my medical appointments, along with the extreme fatigue. So I felt like I had been kidnapped and that my life was no longer mine. And in many respects, it wasn't. I no longer had control on what I could do. I was too sick and I very quickly had to quit work once the treatment started as well. I was embarrassed. I was embarrassed to be sick because look at me, I look well. And it's really hard to explain to people that you're not a well person. I was embarrassed to ask for help. I figured, no, I can do this. I've managed everything else by myself. I could do this. I was embarrassed about finances might become a problem. And I thought, how am I going to manage my rent here, my food? all my travel, and as you'll see, I'm going to speak, I wasn't able to have my stem cell transplant where I lived. So that creates a whole other issues for us. So we're wondering what kind of feelings you may have experienced that I haven't talked about here today. And if you just want to go to the Q&A, you certainly can just put any comments into the Q&A section down, and it should be on the lower taskbar for most of you and in the screen.
I think you may have hit the most common points.
I
Okay,
guess.
good, good.
Hold
Okay.
on, I do have one.
Oh,
Also was hangry, a
yeah,
tiny
angry.
bit of anger. Yeah,
Anger. Mhm,
Mhm.
mhm.
I totally understand about not being in control at all anymore.
Mhm.
Correct. Why is this happening to me? I
Why
was
me?
very worried about leaving my kids. Oh, that's true.
Mhm.
Thank you for your responses.
And certainly if you think of other comments as we go through the presentation, just send them, and Corinne will just interrupt and we'll address them. So the first thing I knew I needed to do after that important oncology appointment was I needed to put in place a support network, because although you live alone, it doesn't mean that you can't have help. So I thought, you know what, I'm going to need help. And I had no idea what I was going to need help with, but I just knew that the way they were speaking about the medications, I wasn't going to be able to manage everything I could. And so some of the places I looked for resources were family and friends, community associations and groups I was involved with. Was anybody there available? So for instance, if I needed a driver or needed somebody to just come and stay with me because I couldn't be alone due to the drugs, something like that. Church, sometimes through the church, there's support. For instance, I found out about volunteer drivers for cancer patients, and that was a tip that came to me through the cancer center actually in Kelowna. My oncology care team became my family. And so for a lot of us that live alone, your oncology care team is your family. They're there for everything. They're there for the good, the bad, and the ugly.
Mm.
There's also hired help. Sometimes it becomes necessary for you to hire out the help, whether it's for housekeeping, maybe transportation, whatever. Psychosocial help. Due to the fact I was having such a time getting through that first piece of denial, I did arrange to go speak to the counselors at the cancer center. And I found that to be a very, very useful resource. And they just, it just helps to put things into balance and perspective for you. So certainly a great resource to reach out to. Another friend of mine had said she looked in the seniors papers for companionship and resources. So we're just wondering what are some of the resources you have used or found to be really helpful in your support network?
Can I just add something?
Yes, Anna.
Yeah. So at Tom Baker, because that's where we work, this is where I met Germaine, we have all of these resources and probably more. So if you have questions and you don't know where to turn to, please ask one of us at the clinic, and we will direct you in the right way, in the right direction.
The other thing that I did was when I first met with the oncologist and with my family doctor, they both said to me, you need to pick one main person who is going to be your go-to medical person. Because in my experience, I can talk to 3 different medical people and I can get 3 different answers for the same question. And so I had to make the decision what I was going to do. And I decided at that point that my oncologist was going to be my #1 go-to person. And that really solved a lot of, oh, what about this person, and this person saying that, and this person saying this. So I would always take it back to my oncologist and just get a confirmation. And that became the stream that I would use in the future.
I do have a comment here, which is pretty
Mhm.
good. One unexpected group for info help and just talking is the Myeloma Canada Vancouver group. amazing, such kind people. There's a lot of support groups in there, and you just have to go on Myeloma Canada's website, and you look under the tab for getting support, and you'll be able to look for one in your area. So thank you for that comment. I will launch, if you don't mind, Germaine, the poll related
Yes,
to your slide.
absolutely.
All right, so let's try this tool now. So on your screen, you probably got a pop-up with a question. So what financial resources have you used or explored? Select all that apply. So you can just tick the boxes, and then I'm going to stop the polls and we'll see the results. A lot of people on the call. I'm just going to wait a few seconds more. So while people are replying, I just have one more comment that I can read. Friends and Myeloma Canada Surrey Support Group. A dance student at Arthur Murrah Dance Studio. So have my dance family. Oh, that person has a dance family now. I call my dancing the psychosocial part of my treatment program. That's very nice. Great comments. Thank you for sharing. Okay, I'm gonna stop for now and see the results. Show that to you guys. You see them on the screen?
So savings, a lot of people have used their savings. And as soon as this comes down, I'm going to take us to the finance sheet as well. Yeah. So family and friends, cancer funds, medical plans, insurance plans, savings being a big one.
Okay. Thank you.
Okay. So Corrine just had this up on the screen. So because I lived in BC, my only option for a bone marrow transplant was traveling from Kelowna, BC to Vancouver, BC, and having my stem cell transplant done as an outpatient. I'd applied to have my stem cell transplant done in Calgary because I have a daughter living here, but I was refused because I did not have a physical address in the province of Alberta. And at that time, I was already into my Cyborg D treatment, so I wasn't in a position that I could make a move. So we just stayed the course, and we ended up going to Vancouver to have it done. So it's very difficult managing all the side effects from the transplant and the drugs and balancing the financial strain. So I maintained my home in Kelowna and utilities and everything, and at the same time had to provide accommodations in Vancouver for myself and a care person. And because I was alone, I couldn't have the stem cell transplant done unless I had somebody that was there to help me all the time. So in the end, I landed up booking us a room at the Jean Barber Cancer Center in Vancouver, and had accommodations for both of us for 10 days the first time. And so Corrine has just asked about the poll. And so we know that most of people have obviously really good insurance plans. Savings was the number 2, and medical plans was the number 3. In my case, I was very blessed that I had girlfriends who held a garage sale. And I'm thinking this will be just a little garage sale. Well, they raised almost between $3,000 and $4,000 for me. And then my church had a pancake breakfast, and they did some other fundraising for me. So and I know for a fact that Lions and Rotary and some other groups will help support, but you do need to reach out with a letter explaining the circumstances. So there are some other resources out there. And yes, we're not feeling well. It's a lot to undertake, but in the end, it is definitely worthwhile, especially if you need the financial help to do it. So we were talking earlier about your life becoming appointments and transportation. Well, my life certainly did. And quite often people would say, how can we help? And I would look at them and I'd say, well, I really don't need any help. And again, we don't really know how that all works until we're right into the thick of it. So I really encourage people to say, if you are asked if somebody can help, say yes. Write down, have somebody take down, one of the people that have volunteered to help be the go-to person to write down contact names and phone numbers, so that when things like meals or transportation come up, or cleaning, or bringing you coffee and just coming for a short visit, then you've got people to help you. And you can go back and reach out to that list. And I know that we're really independent when we live alone. So this took some doing on my part to say, yes, I do need help. And after I did, I was very, very thankful. I'm thankful for great girlfriends who came and spent the time with me. And as you can see, lab forms became a big part of our life. And so I'm wondering, what are some things that you may need help with that we haven't talked about here?
I do have comments about transportation. That is the main issue.
Yeah.
Yeah.
Transportation is huge.
Lodging
Yes.
also?
Lodging, yes. Yeah. The other thing is because you live alone doesn't mean that you're financially stable and have the extra money. And in my case, like the cost of staying at the Jean Barber was equivalent to a hotel room. And fortunately, 3 meals a day were included when we were there. But if we were at the hospital for a day, we were eating at the hospital as well. And so I made a commitment to my care people that I would carry the financial responsibility, because they were good enough to give 24/7 of their time for my help. So yeah, lots of things to think about. So this was just an example of one of the appointment and transportation schedule sheets that that appeared in my life. And so you can see, like, the date, the time, where it was going to be. Was it going to be at my home? Was I going to be at the bone marrow transplant clinic? You know, where was I? And this is the day that the people had signed up to help. And this was what they were there to help me with. And as we all know, the longer that we are on drugs, the more chemo brain we have. And we can look at someday and say, well, yeah, no, I don't know who's going to be here today. Or no, it's going to be so-and-so. Or I'm supposed to be here when I'm supposed to be somewhere else. So things for help was like meal help for the week. Whether they came and just helped prepare, or they arranged for a group. I had a group that dropped off food every day, and one person was the go-to. They would drop it at her apartment and she would just quietly bring it in, put it in my fridge. So I was not disturbed the whole time for that. Sometimes you need somebody to come in from home care and help with showering, or just personal care. There's lab work and hydration. And believe me, you're at the lab a lot in those first early days. There's hematology or oncology appointments. I also had a relaxation class because I needed to sort of break up all the busyness with the appointments and have something that was a little bit more fun in there for me. And then, of course, there's chemo day and there's housework. So is there anything else out there, any other kind of appointments that you might think of that you might have had that we haven't talked about?
I see your line there with housework. I had a comment that she needed help for cleaning her place, need help for pet care. That's a good one.
Oh,
I
pet
didn't think
care.
of that one, but
Yeah.
that's a good one.
Someone to walk your, for instance, a dog. Yeah, for sure. Yeah, and you might be able to even reach out, just a thought, to a local high school in your neighborhood too, to have a high school student come and walk your pet. If it's as simple as that. Okay. So then treatment began July 17th about of 2014. That's when I met with the oncologist, and she said, well, next week we're going to start chemo. And I'm looking at her thinking, like, really? Like that quickly? And she said, yes. So on July 31st, I had this beautiful little baby boy born. And so we were able to delay the start of my chemo for 1 week so I could fly to Calgary. And I was here when he was 3 hours old. So I got to see him. And as you can see, my other grandchildren are really quite young at this point in time as well. So we started Cybor D, cyclophosphamide, bortezomib injection, and dexamethasone. And I'm just wondering if there are any transplant eligible patients out there. And I think this is a poll question too, Corinne. Yeah.
Yes, I'm going to launch that poll to you right now. Give you a few seconds. Are you transplant eligible? Yes, it will be coming. Yes, I already had a transplant. No, I'm not eligible, or I do not wish to have one. I don't know, Anna, if you can jump in and give a bit of explanation about why we would not be eligible, for instance, or maybe Germaine, you will talk about that. I don't want to.
No, I'll let Anna address that.
Okay. Do you want me to wait till the poll is done, or
No, while it's
while it's
cooking,
okay. So in Calgary or in Alberta, the cutoff age is usually 65 years old for a transplant, but we have had patients that were up to 70, and I think I had one that was 72 because the patient was really fit and no what we call comorbidities, which means other health issues. So no diabetes, no cardiac problems. So usually, even if you are eligible, let's say at 65, but you have diabetes and some sort of heart condition, they wouldn't do the transplant because of everything that comes with the transplant. There could be some horrible side effects. That's the main reason for to be ineligible for a transplant.
and that's
After
that's when we say it's the physical age, right?
It's the physical age, yes. Yeah.
I'm gonna show the results now.
66% have had a transplant.
Yeah.
31 are not eligible, and 3% I do not wish to have one.
Mm-hmm.
Yeah. And out of 32 responses. Okay, good.
Oftentimes, like we've had more than 3 people actually that have said no to transplant, and it was because they were the sole family income earner and did not want to lose their job or stop working. So they went with the treatment instead. That's just an example though.
I wanted to just say that I lost my inner ear balance piece after the first treatment. And I also developed something called gastroparesis, which meant that my stomach muscle was partially paralyzed. So digesting food became an issue. And the inner ear piece is not the crystals, it actually is the inner ear piece. And so unfortunately, to this day, I have to say that neither of those two things have gotten any better, but we've learned to live with them and work around them. So it's much later, I found out, I think it was 2 or 3 years later, after some extensive testing, and that they discovered that I'd had a toxic reaction to the bortezomib. Mm-hmm. So that can happen, and it certainly can be worked around. So this would be an example of what one of my cycles might have looked like. So I have hyperthyroidism, so that's why you see the levothyroxine, or you might see Synthroid is the other drug that they use. And so I had a list so that I knew I would take, that was the dosage, and this meant I took it once a day. And I have a little bit of a medical background, so there are a few little medical terms in here. So OD is once a day, and PRN is as necessary, and Q4 is 4 times a day as needed. And the big thing is most of us are on valsiclovir to stop shingles, and dexamethasone. We're all familiar with good old dexamethasone, and initially I was on 40 milligrams, 4 days on and 4 days off. So really, I called it my crazy making drug. And I had to learn some techniques to get my body to relax and settle down. So Zofran is an anti-nausea medication, and Nexium is for the stomach, and domperidone is also for the stomach to improve the motility of the food as it goes through. And Zopicone is a sleeping pill. So that was just sort of what one of my treatment cycles would include as far as medication. And then I found it was really important to take the medication as it was prescribed and note down any side effects that I had. And I got in the habit of double and triple checking my medications. I had actually a spreadsheet, but you can use a graph sheet as well. I'd have the pill boxes, and on one side of them is your days of the week. The other side, I would have a little sticky with the medication that went in there. So sometimes if it was only one medication, that's fine. But if there happened to be 5 different ones, it was listed on the back. So anytime my helper or a visitor came, I'd have them double check, because there would be days I'd think, oh, I took it, or did I take it? And I'm second guessing myself. So I always had somebody else have a look when they came in to see me. So you can always have them pre-packed at the pharmacy as well. And so just some different tips and tricks that I found that worked really well for me by myself. This is the class of drugs that some of us will see. I have been on 9 of them to date. I'm on my 2nd line. And so I'm very fortunate. There's other people who have had a lot more. The reason I have the prednisone in there is I was really prone to bronchitis and pneumonia prior to even starting all of this. So I just tucked that in there. And then my first round was, of course, the bortezomib, cyclophosphamide, and the wonderful dexamethasone. And as you'll hear in a bit here, I relapsed in 2019, and that's when I went on Revlimid or lenalidomide, daratumumab, and dexamethasone again. And we also topped it up with some Zometa treatments to strengthen the bones. And the Zometa treatments were done until the early 2020, when I was facing some extensive dental work and a total knee replacement. And so being a biphosphorate, I think that's correct, Anna.
Biphosphonate, yep.
Yeah, you can't have the Zometa in your system for healing, right?
For at least 3 months.
For 3 months.
Yeah.
Right. So I realize that others out there have had some of these other lines of treatment, but this just gives you an example right now of all we have many options here in Alberta. So we're very, very fortunate. And if you'd like to see what class of drugs have been approved for your province, I believe there's a really good sheet up on Myeloma Canada in regards to that, isn't there, Corrine?
Can you repeat that? I'm sorry, Germaine.
I think Myeloma Canada has a sheet up of the drugs that are approved by province.
Exactly.
Right. Okay. So
it's called a navigator.
A navigator. Great. Yeah. Okay. So I had created a spreadsheet that tracked the drugs and the side effects of the drugs. And I would take it into all my oncology appointments. And the comment from the nurses was, you have just saved us 20 minutes of work of asking questions, and saved us hours of going through flipping back through your diary. So this looks busy, and I've got it broken out into 2 other smaller slides. So just bear with me for a moment. But in the top part, I would put the drugs. I would have the chemo days, the 1 to 28, and then I'd have the actual calendar days so I could follow it through. I would have the meds, the medical appointments, and then in the bottom half, and we'll talk about this more, I'd have side effects, and I'd also have activities and weather and that. So this spreadsheet, I'm in the process of working with Myeloma Canada on, so that we can make it available for people to use. And I'm just gonna go here. So for instance, on the drug side effects, I had it on a scale of 1 to 5, meaning 1 was I had little or no side effect, and 5, I had a very severe side effect. And as you can see going down the list, any of us that is particularly on Revlimid, we know which one we would go to first, right? The diarrhea. And so there are all of these other symptoms that happen. And so on the spreadsheet, I would just have, okay, I'd say Okay, digestion, today was a 4, tomorrow it might be a 5, then it might be a 3. And the nurse could look at that and she could see where in the chemo cycle I was having the most difficulty with food, with bowel movements, with sleep, with any of this. So I found it to be a really great resource, and I didn't have to flip back in my diary to at a glance. I could see where I was in trouble. I also had a line on there that I could say what the weather was doing that day, because I used to find on the cloudy days, you wanted to just stay in bed and pull the covers over your head. And then I would put how I felt. So, if it was a sunny day, I might be feeling angry or bad on a sunny day, and it was okay to be that. So I just scored everything by a scale. And then in minutes, I would also put what kind of exercise I did that day, or what kind of social activities I had done, because I found it was very important to not be alone all of the time, because you become too much of a hermit, and it's not good for you either.
Can I just say that I do have, I mean, I love your spreadsheet. I have some patients that keep it very simple and just bring me a calendar, and they write on the calendar what's going on. And it's a good way for us to actually track when they have more nausea, or when they have the diarrhea, or whatever side effect. And we find this very helpful.
Right. Yeah, I just created the spreadsheet, and then I would use a pen to write in it. And I have to say, I created the spreadsheet to keep my brain active and my thought processes going. And I would just photocopy it. And then every month I would just in pencil or pen write in whatever the numbers were. But great idea to use a calendar as well. But just to give people some examples of what to keep track of sometimes that, like for the care team, it's huge.
We have one very similar in our clinic if anybody wants to use one.
Good. So as I had said earlier, I had to go to Vancouver for my stem cell transplant. And so I had to go down twice because we couldn't get the collection and the transplant at the same time. They did not have a slot in the BMT clinic, the bone marrow clinic, for me to do both of them back to back. So the first time I went down in the middle of November, and I was down for 10 days, and I had to do the filigistrum for 5 days each side. And then here I'm hooked up to the ascoparesis machine. So for those of you that haven't had a stem cell collection and you're wondering what it was like, in my case, I had my Hickman line in, which I'll show you a picture of that in a minute. But normally you would get an IV in one arm, and it's connected up to this wonderful little machine here, and your blood is pulled out of your body. It sounds funny, but your blood is taken out of your body, goes through this machine, is brought back, and it goes into the IV in the other arm. So it pulls out the stem cells while it's in this machine and comes back. So it felt nothing. You just lay there. I was there about 6 hours. I experienced a little nausea, and the nurse said, "Oh, here's a little bit of gravel for you." And it took care of it. And so other than that, you just, you can read a book, you can watch TV, you can do whatever you'd like to do in that time. So again, I was down there for 10 days. We stayed at the Jean Barber Cancer Center. The travel was arranged through compassionate travel through a company called Hope Air out of Ontario. And I had to give them my designated appointment times, medical times. They would phone and verify it. Then they would arrange a flight for myself and my care person. I could not fly alone. So the flights were for myself and my care people. And you'll see that we've got some pretty slim cut haircuts here. And so I had made the decision that I didn't want to wake up one morning and have hair on my pillow, or I wasn't sure what that was going to look like when I lost my hair, and I knew I was going to lose my hair. So I made the conscious decision to have my head shaved, basically. And so when I did it, my sister came from Edmonton to do it, and this is my daughter, and my daughter did hers, and she had long shoulder length hair. So we made a party out of it. This is a friend of mine. Her daughter was a hairdresser, and she made a nice social gathering out of it. And so it made it special, and it wasn't such a hard thing to do in the end. And so then I went back down to Vancouver.
I just have a question,
yes.
Germaine. You were talking about getting on a plane with your care person. So
Mhm.
what if you didn't have anybody to travel with?
I didn't have a choice. They would not do the transplant unless I had a care person. And my daughters were not able to. As you see, my babies were really, really young and they couldn't be around the chemo. So I had to find a care person to come in this case. I don't know what it's like in other provinces. And I was really, through this 25 days, I needed help because I was not in the hospital. If you're in the hospital, it's a whole different issue.
Yeah.
But I
Was-
wasn't, I had,
Was it
Yeah.
somebody you hired, or it was like a friend, or?
in my case, 3 girlfriends split the time between them.
Okay.
Yeah. So the one that came down for the 10 days, she came down for the first week, and then a second girlfriend came for the second week in a bit. And then the last girlfriend stayed till the end, till I could fly home. Right. So when you're in the hospital, I only had a bed from 7 a.m. to 7 p.m. So after 7 p.m. at night till 7 a.m. in the morning, if I got sick or if I left that BMT unit sick, I had to go to the emergency department of that hospital and get care. So when you have your transplant done and you're an inpatient, you always have a bed in the hospital. Am I correct, Anna?
Absolutely. I still can't get over your story every time
Yeah.
you tell it. Yeah.
Yeah. Yeah. Yeah. So the first day, when we went down, we check into the BMT unit. It's 7 a.m. whatever, and then they surgically implant the Hickman line, and this has 3 ports in it, so they can do the chemo out of one, your blood work out of one, and whatever other necessary things they do out of the other port. And I think, is that a standard procedure here in Calgary that they get a Hickman line?
Not anymore. No, we
Not
just
anymore?
put in a central line.
Okay.
It looks similar, but it comes out of your a jugular vein, so
Yeah.
it's not the same, but it does have 3 lumens like that. And
Right.
for the same, one is specifically for the melphalan and the cells, and
Right.
then one is for blood taking, and one is for IV hydration or anything else if you need blood transfusions or whatever. It's just so that we don't mix the lines up.
Yeah, exactly.
Yeah.
I have to say, unfortunately, my line got infected about
Yeah.
day 16,
Hmm.
and my veins weren't able to support having the IV done through my veins. And so they kept the line in for a couple more days, and then they had to pull it, and I had to go on oral medication. But it's just one of the things that happened. Yeah. So the second day you get that heavy dose of melphalan chemo, and again, it's just done with an IV in your arm. And I didn't feel it then, but I did feel it later. And then
Did you have, sorry, Germaine, did you have the low dose chemotherapy before, like fludarabine, cyclophosphamide?
No,
That too. Okay.
no, went straight to the full on dose of
The
melphalan
melphalan
in,
and
yeah, in
okay.
2014. Yeah.
Okay.
Yeah, there was no other nothing. You did your Hickman line one day, they x-rayed it to make sure it was
Right.
all
The
in
same
place here,
place.
because
Yep.
it's in your jugular vein there. And then the next day they do the melphalan, and then they do the stem cells, that they reinfuse your stem cells. And I was I have to say, I was a little disappointed. I thought it was going to be a big deal. And the doctor and the nurse come in, and they come in with my bag of stem cells, which just looks like a bag of red blood, actually. They hooked it all up, and in 20 minutes they had infused my stem cells back in. And they just watch you for, they're there to watch for a reaction and that. And so, yeah, it just went back into the IV in my arm. And so I thought it was going to be a whole lot more than that. And then you start the days where your counts go up and down. And I looked back, and I actually had a copy of my counts for when I was there. So you can see on the 3rd, the white blood count cells are up, and then they dwindle. And by day 14, they're down to 0.2. And you'll also notice my platelets really bottomed out. And so I was in Emerge one night getting a platelet transfusion because that's too low. I think is 50 the bottom line, Anna?
It's now 30.
It's now 30.
Yeah.
Yeah. And I think they were just really concerned that there would be some issues if they didn't top it up. So there I was, and I had stayed, this is my room, my side of the room at the Jean Barber Cancer Clinic. So it had 2 beds in it. It was just basically like a hotel room. Yeah.
That's funny because I had one comment is, did you stay at the Canadian Cancer Society Lodge in Vancouver, next door on West 10th at BCCA? I think we got the answer now.
Yeah, no, it was the Jean Barber. I want to say it's I know I was by the Cancer Lodge too. I don't know if they're considered to be the same thing, but it was called the Jean Barber Cancer Lodge at that time. And it's only a couple of blocks from the hospital. One thing that I did learn though is that partway through here at the halfway mark, they give you some more filgrastim to build up your stem cell, to build up your
White count.
your weight counts again. And when I had initially had the filgrastim to build them up prior to the stem cell, they gave me a prescription in hand, and she says, you need to take this to the pharmacy down the hill on Broadway. So I said, okay. So down I go with the prescription in hand, and I give it to the pharmacist, and he says to me, do you have any idea how expensive this is? And, I said, no, I don't. And he said, 1 dose of this will be $2,500. I looked at him just shocked. I thought, oh my gosh, how am I going to do this? So we had a bit of a discussion, and in the end, he was able to get it procured through the Victory program, the compassionate program. So there are, I learned a lot on this journey. I learned where I had some resources and that I didn't know about. And just, I have to say this pharmacist was absolutely awesome, because there I was crying in his store thinking, how am I going to afford to be able to do this? And I not only need 1 prescription of this, I need 2 prescriptions of this. So yeah, just some things, anytime you got handed a prescription in hand, my thing was, oh, I'm going to be paying for this. So you never go down thinking, oh, it's only going to cost me this, because there's always hidden costs that you don't foresee, that you might have to deal with.
So here in Alberta, we have special authorization forms. So we send out these special authorizations if you have Alberta Blue Cross, and then they cover the cost of filgrastim or Garstafil. And for some of the nausea pills, we may get some special authorization, but we use Victory program a lot for our patients.
So of course, we do have different provinces on the line. So just keep in mind, there's compassionate programs in most places. So it's just to get the information from your healthcare.
Right. They may be called something different. I think the key word to use is compassionate. What type of compassionate programs do I have access to? And whatever they're called, sometimes they're drug company orientated. And I think, is the Victory program not a drug company sponsored program, Anna?
It's a volunteer program. It could be. It's also different companies, private companies that put money into this.
Okay. And that's what Hope Air was for my air travel. When I spoke with them, Hope Air is a compassionate travel company. And what happens is, for instance, if you can afford to donate a WestJet flight or an Air Canada flight or any flight, you would contact this company and you would donate a flight. And so then when, for instance, I called and said, I need to go to Vancouver for this medical appointment or for this transplant, then there's some criteria that you definitely have to meet, but then they look and see if they have availability for you to do that. So very good that some of those things happen that way. So whether you're donating or in a position where you need to use that, just know that those things are out there for you. So this is on the rebound side. This was about 2 months in from my transplant, after my transplant. And as you can see, I still don't have any hair. It took about 4 months for my hair to start growing back. And my little people, only 3 of the 4 were born at this time, and they were all still pretty tiny, but they would come and visit when they could. And then my daughter and my granddaughters that live in Saskatoon participated in the Myeloma Canada March on my behalf. And as you can see, they had a sign on the end of their on the end of their wagon. I think Mommy did most of the walking in this, but they had a sign on the end of the wagon that said supporting Grandma Germaine. And that's a family picture of me with all of the little grandkids. So all my kids got really involved in it. So the next thing I want to
Germaine?
talk about is I want to talk about, oh, sorry.
Yeah, Germaine, I'm just going to interrupt since you were talking about your transplant and after transplant.
Mhm.
So I did have one question. What does a transplant typically entail in terms of length of recovery and adaptation? So maybe we can pass this along to Anna as well, if you can comment.
On the, sorry, on the, what was
The
the
length
question?
of the recovery after a
Oh,
transplant.
it's very individual, I think. Some people come out with like they want to leave before the 21 days that they're supposed to stay in hospital because they have no side effects, and then others are there longer because it's the nausea, the diarrhea, the infections. Because your neutrophils drop to almost, well, to zero, then you're just prone to any infection. And as we know, hospitals, as lovely as they are, they're a petri dish of germs, and so you're susceptible to a lot of different bacteria or viruses. The Hickman, which we now put in central lines, they're always prone to infection. That's, I mean, we hate putting them in, but they're great for us to do our work with, because it's a big source of infection. We do see patients for about 100 days. That's where our cutoff post-transplant, 100 days post-transplant, that's when we start to see you less and less. But we see you quite often the first 100 days post-transplant.
And Germaine, how about your
mine? I was
recovery at home?
I never really I was 4 years in remission, and in that 4 years, 2 of them I was totally dependent on walkers because I had no balance and I still had the stomach issues. And so, like Anna said, I've got friends who had no side effects, but because I had those 2 particular ones, I haven't been home free on any of this, but I've learned to enjoy my well days. And so that's how I deal with it. So Anna said, it's very dependent on everybody. I also had an infection, a very bad infection in my Hickman line, and I came home on drugs, and I was on medication for quite some time to get that infection cleared out of my system. So
and there's also the risk of blood clots because you're in bed for a longer time, so you're at risk of getting blood clots. So not only do you have to give yourself injections for the filgastrum, for example, to boost your white count, you have to also give yourself an injection to prevent of tinzaparin to prevent blood clots.
Blood clots, yeah. And I was also, when I went home to Kelowna, I did not have a bed at the hospital. So again, I was home. And in this case, I didn't have a care person with me every day. I had a neighbor who would check in, but I lived alone. And so I had to just be really on top of things as much as I could. Or when people came to visit, I always would say, if you notice that something's really off, then these are the people that you can call. And I had a list on my fridge, and we'll talk about that in a minute, of people that were my standby and in my emergency people so if you came to visit me and you don't know me very well, but you just came to have tea with me, but you notice that I'm not functioning very well today and I'm really off, and one of those people would be the person that you would call. They'd be my main go-to. And so I hope that answered the question about how long is the recovery. There's no hard and fast answer.
Second part of the question was about adaptation. So you talked about using a walker.
Yes.
In some cases, I guess maybe the dialysis would still be going on for a few patients, maybe, Anna?
Dialysis?
Yeah.
That's rare.
Oh, it's rare. Okay.
Yeah, I've never had a patient, unless the patient was on dialysis to begin with, probably would not get at our hospital, would probably not get a transplant.
Oh, okay.
Yeah. Something else to add We have a buddy system as well. So if you live alone, we would ask that somebody come and check on you every day. Either, wave to the neighbor, have some
Mhm,
sort of signal that you're okay.
mhm.
Just, Germaine is going to talk about that as well.
So that leads me into the safety things that
Mhm.
I've put in place and things that have come up over the last 9 years. So the fall button or emergency lifeline button with the GPS, that only came into play in 2019 when I relapsed, and my kids were quite concerned and I really was not functioning well. And we thought, well, to live alone, I need to do this. So all it is, it's a button and you just push it. If you need help, and right away there's somebody on the line to provide help. Or if you fall, in my case, if my button gets within 2 feet of the floor, it goes off. And right away they're calling me from the company I belong to ask if I'm okay, if I've had a fall, do I need an ambulance? And if you don't respond, they'll call you give 3 emergency contact people, they'll call the contacts. If the contacts can't get a hold of you, I've known cases where the police have come and the
Mhm.
ambulance has been dispersed as well. So I find it to be good. The other reason I like my call button is I walk a lot. And so I do take the walker when I'm outside. But if I'm out walking and there's something going on around me that makes me feel uncomfortable, I can just press my button and right away somebody's there, and I can just say, somebody's following me, or I don't feel well, or whatever the reason is, and help will come. So I really like it because I never have to worry about in a way, I don't live alone now because I've got the button. Always got help readily available. The other thing I did is we talked about walking aids already. So there's some days I can go to just a cane or walking sticks. And again, because that balance on my left side, that left side is I have to be very, very careful where I'm stepping. I don't, where my feet are and everything. So it's just an awareness I've had to learn to work around. In my house, I've had an OT come in and do a check in the bathroom, the bedroom, the kitchen, throughout the house. Like, where could I use some aids that would make my life better and would prevent a fall? So bathroom bars, especially in the shower, and well, even just anywhere in your bathroom, are always a good thing. I didn't need a bed rail, but I did get a lower bed frame. So when I sit on the bed, my feet are on the floor. They're not raised off the floor, and I'm not stepping on a stool to get into my bed. So just some just safety things. A personal check-in, Anna called it the buddy system. So I have people that I check in with every day. And so we're doing each other a favor by doing that. And just, whether it's morning or evening, whatever. In Alberta, we have something called a green sleeve, and all it is it's just a green plastic sleeve. And they've asked for it to be on our fridges. And it includes a current medication list, my personal directive, my power of attorney, and also goals of care. So goals of care in Alberta are something that you've discussed with your doctor about what you would like to happen to you medically if something happened and you couldn't speak for yourself. Right, Anna? Is that
Right. So
yeah?
if you stop breathing or if you have a cardiac arrest, what do you want us to do? Like, do you want us to do CPR? Do you want us to intubate you? Do you want to be taken to an ICU? So this is what the goals of care are for.
Mhm.
In Quebec, we do have something similar on the government of Quebec directly, where we can fill those requests.
Yep.
Mhm. Mhm. Okay. And I learned the next one the hard way. I had to have the ambulance come for me. And in my living room, I had my furniture arranged, and I had this nice rug and coffee table and everything. And the first thing they moved out of the way was the rug and the coffee table so they could reach me on the couch. And so their comment after was, arrange your furniture to the outside walls of your room, remove anything that is a tripping hazard or would be in the way. So I thought that was a really good point. Yeah, because you never know when you're going to need the ambulance people, or when you're going to need to have a wheelchair. And even just having a walker in a home requires more room and space to move around. So I thought those were good things. And then I also created, talked about this just briefly, an emergency contact list that sits on my fridge. Everything is taped to the front of my fridge. So people come in, they know to just go to the fridge. And there, when I was having meals provided, and if I have appointments that I need transportation, the list was on the fridge. So it didn't matter who came in, they could go to the fridge and everybody was on the same page. They got the same information. They knew what was happening. And then I found that with the chemo brain, sometimes I would be starting to get ill and I wouldn't recognize the signs or the symptoms of it. And so my daughter had said, Mom, why don't you just start a couple of little lists that have a few little things on them, like, okay, runny nose, fevers, chills, and then put a question mark on the bottom, cold, or book a doctor's appointment. Just some little things to trigger your memory so that you could, be on top, stay as on top of it as you could. So I think there's a poll question here for what safety measures do you have in place?
So it should pop on your screen, and it's multiple choices. Tick whatever you've used before.
I'll just add, when you're admitted to Unit 57 at Tom Baker for transplant, we have social services that comes to see you as well. And they have an extensive interview with you, actually, and they find out what your needs are as well. And they send people to your house. They'll send either home care or OT or PT or they will make sure that where we're discharging you is a safe place to be. And if you live more than, I think it's 30 or 40 minutes away from the hospital, then they ask you to stay at the hostel or one of the BMT apartments so that you're close to the emergency if something should happen.
And I'll wait a few seconds.
So I really encourage you to use the resources, like check at your cancer clinic and just use any, reach out and just see what resources are available and tap into the ones that you need.
So I see right now, because we have other. So if ever what you have in place is not part of the list, I'd like you to put it in the chat as well, in the discussion, not the Q&A, but the discussion. And this way we can all see your tips, special tips that are not mentioned here already by Germaine. So I have 17 people who have answered. I'm going to stop it there and share. So a lot of walking aids, check-in daily. Yeah, well, most of them actually. Good. I do have 4 others, so I'm waiting for you. So grab bars and showers previously installed. Good. Anything else? Thank you, Leah. You can move along and go back at the end and share other comments that were left behind.
Yeah, no other emergency buttons. That's interesting.
My husband.
Your husband? Yeah.
She's saying, I'm fortunate that I have him. Yeah, that's
That's nice.
he's a good tool.
Yeah. Some people will have a partner.
Yeah, that's great.
Yeah.
So another one is saying, I'm starting to hook up on all my support with each other for their sake. No confusion of resources, no surprises.
Yeah.
That's good.
Good.
Thank you for your comments. I'm gonna unshare now. I
Okay.
can move along.
So the other thing that happened to me was I've lost my immune system in all of this journey, and I've required having what they call IVIG, so immunoglobulin transfusions. So when I started just after my transplant in 2015 in Kelowna, I had to go into the hospital once a month and have an IV to have this done. And when I moved to Calgary in 2017, I was introduced to a home infusion program where I learned to do it myself. And so at home, I do 80 mils every 2 weeks, subcutaneous. So I run 4 lines, so 4 little needles in my stomach every 2 weeks to put this product in. And so what this does is it just gives me energy and it helps fight infections. So I've hardly been, touch wood. I did get COVID in January, but yeah, that's too, that I think we all kind of maybe got a little bit of it this year. So anyway, so that has made my life a whole lot easier. I can travel anywhere in Canada. I'm checking into whether I can now travel outside of Canada because they've changed the product now, doesn't come in a vial anymore. It comes in a preloaded syringe. So that makes life a whole lot easier. One thing I did learn though, when I moved provinces was that I had to be prepared for relapse, and I had to be prepared for moving provinces. So some people say, well, what's involved when you move to a new province? So my first thing I did was I notified my oncologist, and she asked me to give her as much notice as I could. And in my case, I was able to give her 8 months notice. So she could arrange with the new province, which in my case was Alberta, to have the files transferred, for them to have time to accept a new patient. And you may be able to say something about this too, Anna, as we go forward. Is it easy when I transferred from another province? If they're always accepted, or is there any cases where they wouldn't be?
Well, during COVID, we weren't accepting new patients. We had to go through different levels of administration to get permission to accept a patient. If you have an address here in Calgary or Alberta, then it's much easier to get to move your file over. It's because there's always, how do we bill it? That's the big thing, right?
Mm-hmm.
Everybody wants their money, and whose budget is this coming from?
Right.
When I moved to Calgary, I had no insurance for 3 months, even though I'm Canadian. I had to wait 3 months before I was able to get my healthcare card from Alberta. Those, I think it's the same for every province. They wait 3 months before they give you a card. So if you're coming in between treatments, and if you can wait the 3 months, that's great. If you can't, then there are special accesses that we can use so that you don't miss your treatments. But having an address is a good thing. Yeah.
So I reached out, I dealt with the oncologist piece, and then I started to research which provinces had the most drugs available between Saskatchewan and Alberta, because my other daughter lives in Saskatchewan. And then I looked to see how many oncologists there were available in the cities I was looking to move into, what resources were there for me. And once the decision was made based on those above things, then I was able to find accommodations, find a family doctor, and make the move. However, because I was on the IVIG, I needed to have a transfusion almost as soon as I moved. I had to fly back and get a transfusion within 2 days of moving, because I couldn't arrange one here that quickly. But in the next 6 weeks, I was able to arrange to get the transfusion here. However, I had to call BC Medical, get their approval to pay for it, and then let the people here know. Like Anna said, it's quite involved, and you have to do your due diligence. And here they wouldn't move forward unless I had whatever it was. I can't remember if it was just a verbal or whatever, but I did have to do my due diligence with BC Medical and get their permissions in order to move ahead and do it. So just be aware of those things. If you are moving provinces and you have medication that you can't be without, then make sure you're making arrangements as part of your move to deal with that. And the
Just
motivational,
one comment about that, because you were talking about changing province. Isn't BC the best cancer program and covers the most in Canada?
No, Alberta
So
is.
each province is different, so we
That's
need
right.
to- yeah.
yeah, what I discovered is that Alberta had the most drugs approved, and we have to thank oncologists here in Calgary, Dr. Neary and Dr. Bayless and their team. And is it still Dr. Venner in Edmonton? I know at the Cross, they
No,
have,
Dr. Venner's in BC now.
is in BC now.
Yeah.
So the Cross in Edmonton also has a great oncology team, and they're doing a lot of clinical trials, but I think we're sort of leading in that end, aren't we, Anna?
Yes, we are. That's because we work for the best. So
Yeah, exactly. So
I'm just biased. That's all.
well, just for comparison, when I looked at the two provinces, at that time, Saskatchewan did not even have Revlimid approved. So the
Yeah.
only thing they had for a relapse was a transplant. And I did not have a second set of stem cells collected. When they
Oh,
collected, they only
okay.
collected enough for one
For one.
stem cell collection, because I had gone back to BC to check in case they had a second set for me, and they didn't. So again, really do your homework before you move provinces.
Mhm.
Really important. So part of the motivational coping skills I put in place to maintain a balance between the sweet and the not so sweet times was I would allow myself 5 minutes of self-pity a day. The days I didn't need this, I would store it up for the days I would need more than 5 minutes. And yes, there were a few of those days. And so the whole idea was, yeah, you're allowed 5 minutes and then you just have to get on with your day. So it helped motivate me to then go and do something positive and just put my mindset in a different area. So other things I would do is, no matter how sick I was, if I live in an apartment, I'm on the 4th floor. Some days I could just go down in the elevator, walk out the front entryway, and maybe get 10 steps out the door. And then I would have to come back. But I got out of my apartment and it made a huge difference. I set a goal every day, doesn't matter how small or big, but I had a purpose every day for getting out of bed. I like happy music, stuff that makes my toes tap. So I always try and have that kind of music playing. I do something special for myself. It might be read a good book I like, have a cup of tea, might be call a friend, visit someone, make a phone call. So my question to you is, how do you overcome those melancholy moments or those melancholy days? Okay, we can't hear you, Corrine.
Thank you.
Okay, that's okay. I could see your lips moving.
I was saying you may use the chat or discussion panel to answer to Germaine.
Yeah.
Instead of the Q&A,
Mhm.
so that all people can see the responses automatically. So wine and good tunes.
I like that one.
Wine and good tunes. Yeah.
I started yoga on YouTube.
Mhm.
Yes, true.
Mhm.
We do have
Nice.
a bunch of things available for free for exercise.
Mhm.
And by the way,
I like that one too.
a little note there that stay tuned with
Good for you, Bev.
with this week's newsletter. We're launching an exercise program for you guys.
Oh, good.
Yes. Life is
Join
precious.
Wellsprings. Wellsprings is great. They have
Mhm.
great things.
Mhm.
Yeah.
And Wellsprings is across Canada too,
Yeah,
I
it is
believe.
across
So
Canada. Mhm.
wherever you
It
live
is.
in, whichever community you live in,
Mhm.
look to see what support is there for cancer patients.
Mhm.
Because sometimes there are nutrition classes, there's exercise groups, there's just social time. So reach out within your community and see what there is there. Mhm.
They have the peer-to-peer program where
Yeah.
you can call and they match you with somebody else that is going through the same thing as you.
Mhm. And I speak very highly of that. I did mine through the cancer center at the time, and I was teed up with a wonderful lady who had also had myeloma, and she was just a super great support for me. Mhm. So I always want to start my day with a positive thought, no matter how hard things are. tomorrow is always a fresh opportunity to make it better. So I try and keep that in mind as I go through. Brain fog is something that we're all really familiar with, and neuropathy. They sort of seem to get both of them. So I would register for online courses. I would set up some spreadsheets like to track my medications. I volunteered on committees. I did some hand-eye coordination activities because I would reach in the cupboard to grab a glass and that would drop before it would just be right through my hands on the floor. So I had been to a brain fog session, and the person was speaking about making sure that your eyes actually follow your hand. So have your eyes follow your hand to the cupboard, reach for that glass, hold that glass, lift it out, put it down on the cupboard, and make sure your eyes follow you. And I found that has been quite successful for me. I'm not dropping as many things. I played games. Games that have pieces in it where you're moving them around and you have to count. So it helps with the neuropathy in the fingers and just get you going, and also keeps your mind active. I read, I meditate and pray. And I have to say, my faith has been my life stay through my whole journey. I do crafts, I knit and crochet. So you can imagine with neuropathy in my hands, it sometimes gets really difficult. So when it's bad, I just pick a more difficult pattern to work on. So then I have to kick in my concentration harder, and I'm counting stitches to know what I'm doing and mixing colors. And so just, sometimes you might have a woodworking craft, you might have something else. Just make sure you're safe with whatever you're doing. And those things all challenge your brain and just stimulate it, and they help work with some of the neuropathy. Some foot exercises will help with the feet neuropathy, and sometimes there's nothing that you can do with the neuropathy in your feet particularly, but make sure that you're using walking aids or whatever you need to be safe. And one of the things that I had done was, well, instead of joining the myeloma support group, I actually was involved in starting one in Kelowna, and ran that group for a year until I moved. So was involved in doing our first walk and all of that. And I have to say a really big thank you to Michelle and Myeloma Canada, because they walk with you and hold your hand through the whole process. So you never are alone in it. And then when I moved to Alberta, I got involved with the Southern Alberta Myeloma Patient Society, otherwise known as SAMPS, and just spent about 3.5 years as a secretary for them, and the rest of the time as a director at large. So you can definitely share your skills and abilities to however you're able to at the time, and just keep your brain stimulated. So we want to know what activities you might have done that stimulate your brain or help you deal with neuropathy.
I do have one on the Q&A talking about jigsaw puzzles.
Oh, jigsaw puzzles, yes.
It's a good brain exercise.
Yeah.
It's brain and hand.
And hand, yeah.
Pets
Absolutely.
keeps us quite busy, and I guess, it helps at some point. Stay active, at least.
Yeah. So really important to do anything that just helps both of those areas, and particularly because the brain fog can be all consuming at times. So if you can just sort of have something there that will distract you and help you get through it, it just makes it a little bit better. Anna, do you have anything to add in on the brain fog?
No, I think you've covered the idea of the hand-eye coordination. That's the big one that we also promote in our clinics. Yeah, and staying active.
Right.
Yeah,
the hand-eye.
Yep, the hand-eye is big.
Yeah. Well, it's huge for me having no balance on that left side. My eye has to accommodate for that. So I've done some extensive physio to retrain my eye to be both balance and vision. So if people are having experiences with that vision and coordination, something to look into. I'm almost done. I know it's getting on there. So I wanted to say that I moved to Calgary in May of 2017, and to celebrate my remission from the first round, my sister and I actually rented an RV and we drove right across Canada, all the way to St. John's, Newfoundland. So it's possible. to do some fun and good
Yep.
things in between times for yourselves. So in 2019, I was already living in Calgary when the shoe dropped, and you'll hear that term quite often. When is the other shoe going to drop?
Mm.
And so the shoe dropped for me, and it was almost 4 or 5 years to the day that I was originally diagnosed. It seems that's how it's all gone in my story. And what did it look like? So my monoclonal proteins,
protein.
sorry about that,
Mhm.
reached 20. And I just felt really unwell. I felt ill, like I had the flu. I experienced extreme fatigue. And the week I relapsed, I was in the bone marrow transplant daycare unit twice for IV hydration.
Mm.
So in combination with what I've just talked about, my blood count, my blood work, and lack of physical well-being, it was determined that I had relapsed. So I did 26 rounds of chemo with daratumumab, dexamethasone, and Revlimid. And in September of 21, I achieved a stable status. So I'm going to let Anna talk about stable versus full remission.
Stable, not complete remission. He said just stable.
Just stable.
Okay.
So my numbers aren't at zero. In other words, my monoclonal proteins
Yes,
have
your
never reached zero.
monoclonal, and it means that your immunofixation still shows some traces of kappa or lambda, and your bone marrow may still have some plasma cells. So if you didn't have any of those, then you would be in either very good partial remission or complete remission. So stable, well, stable is not really a term that, is it stable from what though?
Okay. Well, good.
So that's what we like. Is it stable from your last 2 or 3 results, or he's not changing your treatment? So that's a good thing.
Right. Right. Yeah. No, my treatment has stayed, and since actually September of 2021, we've had to hold the Revlimid because I have been diagnosed with secondary skin cancer, which has had to be dealt with. I needed to have a total knee replacement. And I've also had a right eye retina repair and cataract repair. So there's times in your treatment cycle that you need to stop some of the drugs or all of them, so that other health issues that have cropped up need to be dealt with and are.
And the reason we usually choose Revlimid is because that's the one, or lenalidomide is because that's the higher risk of blood clots.
Yes.
And it really drops your neutrophils. So we want your blood to be at a good level when you're having major surgery like a knee replacement.
So after being told I had 3 to 5 years to live in 2014, then I was told I'd have 5 to 8 years in July of 20. So now here I am in July of 2023. I'll be 72 years old this year, and I celebrate 9 years since my myeloma journey has begun. Every day has been a gift that's been enriched by all the people who have touched my life and provided love, support, and care. So I'd like you each to remember that your journey is your own, and it has its own unique set of challenges. But don't forget to live your life to the fullest, create a new bucket list, be thankful for your blessings every day, and enjoy your wellness. And thank you very much for participating with me. I want to thank Anna and Myeloma Canada and Corrine and all the participants. Thank you.
Thank you so much, Germaine. It's 9:30 here in Montreal, so obviously 7:30 for you guys in Calgary. I'm still going to take a few minutes for those people who want to stay on the line. The recording is still going on, so if you don't mind, maybe taking a few comments or questions that were not answered. So I do have some. Hold on. So one comment. So I was diagnosed in 2014 and lost my partner to cancer in 2019. Feel scared and alone. So I guess that's the kind of situation where, or living solo with myeloma. Unfortunately, that's one case here. Just wanted to mention that nice comment. So what does a transplant, oh, I did answer that, sorry. So I use an app on my phone called MediSafe. So I wanted to mention that. That's one of the tools that can be used for, I guess it's tracking, put in my medication and time. So I think a good point within your presentation today, Germaine, was about tracking. So you have a nice spreadsheet. I'm going to make sure, by the way, to provide that spreadsheet to all participants that have registered for today's webinar. So this will be sent out to you guys, and eventually will be made available as a new Myeloma Canada tool in the future. So that was an app. Thank you for that comment. One question for you, Germaine. Did your hair come back in a different color? My gray salt and pepper left it and came back totally dark brown.
My hair came in totally white, snow white, and it was very, very curly. So it was like an afro. It was so tight. And I had it stayed curly and snow white for, well, it stayed curly for 2.5 years, and then it just relaxed. And as you can see, it's looking quite dark now, and it's just gradually darkened up over time. All my hair came back. I didn't have patchy spots or anything at all. I have, I'm very blessed. I have a very full head of hair, and it all came back very full. So yeah. So you never know what you're going to get when it grows back. I think it's always a surprise, right, Anna?
Yes.
Cost of out of country travel insurance, even for treatment for this pre-existing condition. So I'm not sure if we're missing a word here, but can you talk a bit more about travel insurance maybe?
Well, what I can tell you is that my 2 sisters and I have just booked a trip to Ixtapa, Mexico for January of next year. And I found out it was too soon to book it, but I will be in a position because I've had in the past when I've traveled, because I have cancer, I'm dinged. And because I've had a stem cell transplant, I've been dinged. So all I can say is just research several companies, just see. You definitely want to have some medical coverage out of the country, because you might, you know, if you don't, like I don't have bone myeloma, but if I fell and broke a bone, I would certainly want to be able to have it fixed. Or if I got pneumonia, I want to be able to have care. So there's other reasons. And so you got to read the fine, what I've been told is read the fine print and make sure that for you with the myeloma, will they interpret it? Oh no, it's for bones. And so once you get over there, it won't be covered. So you really have to do your homework. I don't know, Anna, if you have any. I know SAMPS, the Southern Alberta Myeloma Patient Society, has a few travel sites that members have used and have found to be really successful. So if you want, just go to samps.ca and check and see what they've got up there for travel as well. But again, that's going to be province dependent.
Yeah.
It's going to be country dependent where you're going. It will be huge. Yeah.
Yeah.
This is
and your medical condition.
Yeah,
Sorry.
it's very popular. And then some of the travel insurance asks for a physician or a healthcare worker to fill out some of it. So you need to get that ahead of time as well.
Right. So look at, they told me that to wait for 6 months prior to travel to go back to them to get to talk about insurance, to get actual quotes. So I'm going to wait until I'm 6 months out. The other thing I've learned too is that if you've had any hospitalization, surgeries, or change in medication within 6 months of traveling, that usually is against you. So just be aware of things like that. But read the fine print and ask the questions, ask as many questions as you can think of.
This is a subject of interest, and it will be part of a webinar in the future because we've had the request. So we're working on it, but basically, yes, you need to look for the options and do your homeworks. All right, so maybe in summary, the best advice you can give, Germaine, for being solo, I guess it would be the aids, right?
AIDS, yeah.
The
Mhm.
tracking with the spreadsheet. What else can we?
Use your
aids,
resources.
yeah, use your resources. Make sure, have a friend. You know,
Mhm.
you really, it's a tough journey to do alone all the time. And make sure you've got that one really good person that you can phone and talk about anything, cry if you need to, do whatever. But everybody needs somebody. Everybody needs somebody. And don't forget to live your life and make the best of it.
Mhm.
Good.
And this is your journey, and only you can speak about your journey. And so, you know, this is my journey tonight that I've shared, and it'll be very different from your journeys. But you know, your journey is your journey.
All right, I think we will close for today. I'm happy to get all feedback and comments after this webinar. You will receive the next day an email, an automatic email with a survey, but also you can write to me directly. Any other question you just thought of after the call, no worries. I'm going to make sure to forward it to Germaine or Anna with pleasure. So thank you to both of you for your time today. For our community of patients, we do appreciate those webinars. It's pretty useful. So thank you to Germaine to have.
Thank you, Germaine.
Thank you, Anna, and Karine, and Myeloma Canada, and
Mhm.
everyone who participated.
Yes. Yep.
All right, thank you, and
Have a good
great
night,
evening.
everyone.
Good night.
Night.
Night.